everyone. My name is Edgar Oscario. I'm from Horizon NJ Health. I'm Community Health Representative for Horizon. And so pretty much what that means is customer service, but on the field, whether it be through your farmer's market or whether it be through phone call, accessible for you guys if you guys have any questions or concerns. Today's presentation is NJ Family Care Made Easy. And how does it work? So let's go for the next slide. So NJ Family Care is the program that New Jersey holds as far as for giving out Medicaid or medical insurance to those who can't afford it. It's mainly for children, but also for adults of low income. We have, as you can see here, different terminology as an HMO, which is the Health Maintenance Organization. That's pretty much like the company that's going to be providing you guys with the care that you need, such as Horizon NJ Health, Aetna, AmeriGroup, WellCare, United Health. Those are considered HMOs. We have the eligibility determining agency, which I won't get into really deep because it's more of the sense of they're the ones that are running the show. They're doing the application process. And then we have our county board of social services, which people can be familiar with, which is like the welfare office, as people like to nickname it. But it's there for the community and most importantly for anyone who is looking for a free health insurance. Now, the biggest question a lot of people are asking me is like, how do you apply for Medicaid? One of the most common ones is obviously going to the Board of Social Services and going through an application process, which is what relatively a lot of people do as of now. However, with things changing now, unfortunately, there are some Board of Social Services that are completely closed to the public, which we can finally address the new situation, or a new way of applying, which is you can apply through the internet. So if you guys go and log into njfamilycare.org, there's going to be a whole site devoted to you guys as far as applying online and being able to answer of any of the questions that you might have, like, hey, do I qualify? How do I know if I qualify? There's all that information that's there. But also too, I'd like to give myself or just to remind you guys that also if you guys are not comfortable with the internet and just logging in, because people sometimes tend to feel a little bit intimidated by the questions that they ask, you can always feel free to contact the Horizon NJ Health for help. We do have an enrollment hotline, and also I also know how to fill out the applications for people just in case if maybe you feel more comfortable with talking to me about your situation, your information. What I could definitely do is be able to enroll you into Medicaid and also give you the steps as to like what you need to do and what to be aware of. So what happens after I apply? I always tell my people it takes up to 45 days for the application to process itself. Usually within the first 2 weeks, they'll send you an introduction letter, which will say, hey, listen, we've received your application. Thank you so much for submitting. Before anything else, we do need some more information from you guys. They'll give you a list of all the information that they're looking for, which is usually your driver's license, social security, proof of address, and then proof of income too. So if you guys are working, they're looking for pay stubs. If you guys aren't working, then they'll ask for a particular set of information from you guys to make sure that you guys are not working. If you're collecting unemployment, they're looking for your unemployment. Within those time periods, once you send over, because they'll give you a whole introduction packet and they'll give you a prepaid envelope. Once you have those copies, you can submit it and put it into the prepaid envelope, send it off, and then that's when your application is going to be crossed over with the EDA and making sure that everything is lined up, and if they'll determine whether or not you guys are eligible for the program. And always, as always, if once you do receive that card, please use it. That is one of the major things that a lot of people don't understand, is that once you get the card, you can go ahead, use it. I like to say use it as much as you need. So that way you guys are eligible, you can go ahead and start acting on your care, on taking care of yourself. One reminder that I want to share with you guys is every single year they have to renew. So let's say, for example, it's November, you apply this year and you receive your card this year. The following year, around October, the beginning of October, they'll say, hey, listen, We just want to make sure that if you do need the coverage, to please renew our benefits. So they'll ask for if you have any additional information as far as like if there's a pay change or there's a new member of the family that's added to the household. Any type of information needs to be updated and sent to them. If not, then there's another process for you to go and say, hey, listen, everything is still the same, but I do want to renew my coverage. So you have to submit, I believe it's a question or a specific information, and also your documents of what are you receiving, so that way they can match up. And then once you do that, you're all good to go for the following year. So here's a bunch of just key terminologies for you guys to know. It's not really important, but it's just for you guys to share. We have our member, which is whoever is enrolled into a health insurance plan. We have the premium, which is the monthly cost for the health insurance, which when you are enrolled into Medicaid, it's you guys don't have to worry about a premium. You guys don't have to pay out of pocket monthly. Usually it's zero cost. Depending on what your situation is, it may differ, but from what I've seen in my experience, everything is just zero across the board. You do have to pay a co-payment with Horizon NJ Health, but it's usually around ranging from $5 to $15. $15 being like you have to see a very specific specialist, but again, in my experience, I've rarely seen that. Usually your co-payment is just the $5 to $10. You'll have your specialist, like I mentioned before. That could be a doctor or a dentist that is specifically trained for a certain type of field. So it could be your cardiologist, it could be a nutritionist, gynecologist, you name it. All right, and we can keep going over. We have our urgent care. So one of the biggest things that we are promoting within Horizon is getting to know the difference between your urgent care and versus a hospital visit. So a lot of people tend to, God forbid, like get into an accident where they have to go, let's say you have a stomach ache, right? So you have a stomach ache and you're like, wow, I really need to go see a doctor because this is killing me. So rather than going into the hospital and going through the emergency room and coming out with a bill of like almost $1,200 to $1,500, what you could do is essentially go to your local urgent care, which is an office or a clinic after hours, usually ranging from like 8 a.m. to 8 p.m. You'll get to see a nurse on staff or a doctor on staff. And what it is it's just like seeing your regular doctor. However, instead of having that big bill that you have at the end, you're paying maybe at most $50, $60 just to get seen by a doctor and just letting them know like, hey, listen, this is what I'm going through. And they'll be able to help you provide prescription for you. So that way you can go ahead and take care of yourself. We do recommend that if it's a non-lethal emergency to go to your urgent care versus going to the hospital. But if it's an absolute emergency, please, by all means, go to the hospital because that's the most important. We do have our pre-authorizations or prior authorizations, our prescriptions formulary. One thing about Horizon is that we're known for like the largest network. So what's awesome about Horizon NJ Health is like, let's say, for example, you decide to go to a beach getaway in Atlantic City. And for some reason, God forbid, an accident should occur and you have to go see a doctor in Atlantic Care in Atlantic Care, you would be covered with Horizon NJ Health. And that goes as far as for our medical providers, our specialists, dentists, eye doctors, hospitals, and labs. When it comes to out-of-network, that gets a little bit tricky depending on where you are. From what I know in my experience is that usually a hospital visit would be covered by us. If it comes to like a specific doctor that you're landing in New York or Pennsylvania, I would highly recommend the first call ahead to your insurance provider and let them know, hey, listen, this is the only place I can go to. Would you guys be able to do it? And then from there, they'll give you an answer. Or at least guide you in a way where if you can't go see that doctor, then they'll try to refer you to another doctor that's maybe close by or in network, which is better. For those of you who are looking for a new doctor, it's finally become easier for you guys to find a new doctor or replace a doctor, or if you're brand new to even look for a doctor, you just log into Horizon NJ Health. You'll go into our new member portal system, which you can go ahead and register. You'll put in your insurance card in there and your member ID. and you'll make a little account. And then once you do that, there's an option for you guys to look for a doctor. Another way you can do it through, you can find a doctor too, is do it through member services, which is the 1-800 number up here. And you can also request for a county director through member services. But I find it easier for you guys to just log into Horizon NJ Health. You don't have to contact anyone. You can do it through the website itself. All you have to do is put your zip code, and there's like a drop-down list where you can look for a specific type of doctor, and then it'll give you the location, the number, and where you can find the office, all in the website. So you don't have to worry about that. These are important numbers to know. I wouldn't go crazy on them right now. I can definitely give you, Denise, a copy of this if people are referring to and just they need some more information on that. But the member services is usually the go-to if you need to change anything, as far as like information and stuff like that. Oh, that's a good point that I brought up. So if you are moving, let's say for example, you have your healthcare, but you are moving, one of the biggest mistakes that a lot of people do is they'll call the health insurance company and they'll say, hey, listen, I'm moving to this new address. Can you please remove me from the old address and move it to the new address? Instead of calling the insurance company, you have to start with NJ Family Care first. Since they are in charge of your application, of your member policy, I would say first, dial NJ Family Care, let them know, hey, listen, I'm currently moving to this new address. Whatever mail that's being sent, or if there's any information that needs to be sent to me, please forward it to my new mailing address. So that way, because our insurance company works off of NJ Family Care. So if it's already in the system in NJ Family Care that you move, then it should be automatically updated within our system to say, okay, well, this person has moved from point A to point B. So we're gonna make sure that they get all their stuff that they need to point B instead of point A. So I want to just go over this really briefly. It doesn't have to be too intense. The first card that you see up front, if you look over here, this is your plain Medicaid. This is your straight Medicaid. If you don't have an HMO, this is what you're receiving. It doesn't really cover much. It just covers like a hospital visit, to be honest. The most important card that you need is the one that says the Horizon or the HMO on the top right or the top left corner. That's the most important one. That's going to get you to your doctor visits, to your eye doctor, to your dentist. Below, you also have, there's another option too for managed long-term services and support. And then at the very bottom, this is more into Medicare and Medicaid. But for right now, we just want to focus on the top one, since this is exactly what I want to explain to you. So on your right hand or your left-hand side is your basic Medicaid. On your right-hand side is the HMO card. When we usually refer to an HMO card, this is the card that we're going to be asking, the one that has the name of the insurance company on the top. All right. And then this is just a brief overview and breaking down what the card looks like. You have your member ID, your policy number, your PCP, the number of it, when it was the issue date. I'm not going to go into it. If you do, for whatever reason, need to contact member services, I would always recommend looking to the back of the card. That's when you'll see your member services number, and you can go ahead and dial them and explain your situation, whatever it may be. Overview in your benefits and services, you guys are entitled to having your routine physicals with your PCP. You guys can go ahead and do the dental cleanings and oral exams up to 2 times a year, and make sure you're doing your EYLEA year exam every 1 or 2 times a year. Into this is programs for people who are looking or seeking for a little bit more attention in certain areas. We do have a care case and disease management on our company. We are actually one of the top rated companies when it comes to being able to have a care manager and saying like, hey, listen, we're just here to do a follow-up with you, making sure that you guys have your doctor visits in place. If you guys done your routine checkups, we have a Mom's Gems program in which people get a little bit more attention when it comes to maternity services. It's another great program that I would recommend for those who are pregnant or are planning to get pregnant, to get a little bit more information with them. They have very good resources for you and your family for the future. We have Horizon Neighbors in Health. You've seen our health educators on staff, probably in a couple of instances where you went to a program, or if you've seen us out in the field. We do offer health education with various community partners. So that's something, if you're interested, you can definitely look into. We also do have our NJ Peer Recovery Program for those who are looking for a peer support line available for people who have done substance abuse or have a substance abuse disorder. And we also do have and offer our Horizon Healthy Journey, which is a program designed to keep you guys on track with your medical attention or with your medical needs. And also it just gives you as an extra motivator to keep yourself healthy for the year. We do have our handbook, but like I said, I would recommend that you guys go into horizonnjhealth.com. There on your member portal, you have access to everything within your finger's reach. So if you are looking for a new doctor, or if you're looking for advice as far as like looking for a new doctor or for your health, that's definitely recommended to go into Horizon NJ Health. Again, this is just part of the member handbook, not important. Always remember to read up and brush up on your rights and responsibilities. I think it's a very good touch for you guys just to make sure, like, hey, listen, if you don't feel comfortable with the care that you have the right to change your care at any given time. If you, for example, are looking, let's say you go to a doctor's office and they only take United, and you need to do that switch, or they only take Horizon and you have United and you need to make the switch, you would have to dial NJ Family Care and let them know, hey, listen, my current doctor is not accepting her United, but they are accepting Horizon. Can you please switch me over? And without a doubt, they should be able to do that for you. Other than that, these are just basic reminders. If you guys have any questions or looking for any information, by all means, look into the member services, call them, or you can go into horizonnjhealth.com and they'll be able to help you out too, if you were looking for like more of a self-help. And these are the numbers that you can do. You can stay connected with member services, the enrollment hotline if you're looking to apply. Horizon NJ Health, I'm going to be promoting that website for a good time. We do have a Facebook page and a Twitter. And lastly but not least, I have my contact information. And if you guys do have any questions on that, I'll be more than happy to answer any questions that you may have.